So this is on gang violence and domestic violence by me and Rachel. The media plays a complex role when it comes to violence. Though there are many contributing factors to violence, it cannot be blamed completely on the media because there are studies that suggest watching violent TV or playing violent video games can increase the risk for violence and desensitization to violence, which can then contribute to crimes. Family support. There continues to be high rates of community and domestic violence. Children are being exposed to multiple forms of violence, and it's creating major public concerns health-wise. There are many prevention programs being put into place, but ensuring children have a strong family support is crucial. Being connected to family, to be able to discuss problems with parents, social activities, and with a parent being present consistently is good as well. The role of peers seems to have a large impact on violence. Peers can contribute to help protect one from exposure or even becoming violent themselves. So involvement in gangs, rejection by peers, close relationship with non-deviant peers, commitment to school, things like that. There tends to be a cyclical nature with violence, with the tension building, then the violent episode, and then the remorseful/honeymoon phase. And it can be notorious for this cycle. It can happen over and over again throughout the span of the abuse or violence. There's no time frame for each step. Each one is very individual. It can also happen when a child is exposed to violence and grows up and repeats that behavior within their own families. Legal/political system. So things like protective and restraining orders. The law can play a crucial role in helping with preventing violence. There are different types of violence, but in the law's eyes, all violence can be considered a crime. There can be different levels, such as federal violence can become a federal crime when certain laws are broken. Each state can differ on what protection laws are available for victims of abuse. For example, emotional abuse may not qualify in receiving a restraining order. Emotional or verbal abuse may not even be considered a criminal offense in some states. Potential barriers, so lack of resources, stigmas against violence or abuse may prevent someone from getting adequate treatment. Fear of additional violence if they leave. Feelings and beliefs like low self-esteem. Religion, where divorce can be considered a sin. Responsibilities like keeping the children safe in a family, even if the family is abusive. Housework, community, things like that. So the international scope of things is there are regions in the world that have higher incidences of violence and crime, but it's important to acknowledge that violence can happen anywhere and to anyone, and this is a global public health problem, not just a local one. So health disparities with socioeconomic status, this can actually apply to both communities. So neighborhood, the neighborhood in which they're raised, the culture of that neighborhood, it can be hard to get out sometimes. Occupation, a lot of these, which kind of goes hand in hand with education, especially in the gang community, education may not be achieved. A lot of kids are dropping out to join gangs or be initiated. Occupation as well. Most likely they won't have a great occupation, if one at all. And a lot of them can be single parents due to either violence that leads to death, or divorce due to the stress, or separation due to not being in a good family unit to begin with. Race and ethnicity, so this ties into citizenship. especially within, well, even with domestic violence and the gang communities, fear of being separated from their family, especially with how the air is now within our country. Citizenship is huge, and a lot of illegal aliens are fearful due to detention centers or ICE or being taken back to a country they may not know anymore. So, and then along with this comes bias, discrimination, assumptions, judgment by other people. There could be a language barrier that prevents them from seeking health care, and culture as well. They may not believe in healthcare. They may believe in home remedies, things like that. Religion, again, this can play into both, whether or not they believe that something or someone is watching over them. Especially in the gang community, there is a bunch of symbolism with this. A lot of them have tattoos that represent their religion that they may view as protection. A lot of it too has to do with respect. They may think it's harder to shoot somebody that has a tattoo of Jesus Christ on them. And a lot of them find religion again in prison, and so they get tattoos to represent their religious backgrounds. Healing is another one that goes into religion. Some of them may believe in holistic approaches from cultures. Latinos, for instance, believe in home remedies and may seek that because it's cheaper and they don't have to risk going into the healthcare system. And tradition can also be tied into that. Gender. So the majority of people that are in domestic violence situations are women. Not to say men aren't victims as well, but the majority of the population is women. And this also ties into the gang population. Women's roles are typically drug mules, transporters, prostitutes, pretty much throwaway roles. Head of the household is usually the man who calls the shots, and this can also lead to health disparities because they may not want their family to be seen in the healthcare system because things can be reported like injuries and things like that, and they don't want the police involved whatsoever, and they view healthcare workers as policing as well. So geographical locations, I'm thinking more in like bigger cities, but this can also be rural areas as well. The location of the hospital resources, like take Los Angeles for instance, they have a county jail or county hospital where they do see the prison population as well as people with no health insurance. So this can be pretty daunting to people, and wait times are long, resources are few and far between, and a lot of the patients are lower income, and these facilities are in the midst of neighborhoods with increased crime rates. Mode of transportation may not be there, it may just be a bus, they may not have access to a car. So I feel utilizing telehealth to reach these populations is vital. Because some healthcare workers may not want to work in a county where there is mostly poor populations or prisoners. But I think reaching these populations is also very difficult. So telehealth, while it is a good idea, I think implementing it will be kind of difficult in these areas. So bias, I know this was in an earlier slide of mine, but bias is that mostly to do with gang population, would be like lower class people, dirty criminals, illegal immigrants. There could be language barriers with both populations, domestic as well as gang affiliated. Little to no education, and drugs and alcohol as well. So I think the international scope with health disparities, I just put countries here that utilize universal health care. However, I don't think this is a fix for getting these populations into the healthcare system, because a lot of it revolves around violence. And again, I think with both populations, reaching across the aisle will be difficult. So again, even going back to the telehealth, reaching these populations, I think, will be difficult, because not only do we have biases against them, they have biases against us, maybe thinking that we're all out to get them, we're all going to judge them, we're all going to involve the police regardless of what they want, that they aren't truly in a safe haven. So I think universal health care, while it is appealing and it will help those that need it, I don't think it is going to be the end-all be-all solution for either of these populations.